Welcome to the Spanish for Health Professional Certificate webinar, which is a new online program brought to you through Catholic University of America, Metropolitan School of Professional Studies in Washington, D.C. This program is for medical professionals in order for them to adapt to language and cultural challenges in the healthcare population. This online program is designed to improve your working knowledge of medical Spanish and cultural awareness. I'm Professor Jennifer Maxwell. I direct the Spanish for Health Professional Certificate at the Metropolitan School of Professional Studies here in Washington, D.C. And I also have, for the past 10 years, directed the undergraduate Spanish for Healthcare Certificate program, which is an undergraduate program. This program here for this webinar is a continuing education bearing certificate. I can be reached at maxwellj@cua.edu or 202-319-5256. So I'll tell you a little bit about myself. My undergraduate degree is from the State University of New York at Oswego, which was in economics. I spent my early career working on Wall Street and then moved over to Spanish. So I attended Middlebury College in the summers and lived in Madrid to complete my master's in Spanish. I also am a medical translator and interpreter here in DC, the metropolitan area of Virginia and Maryland, at hospitals and clinics, schools and organizations. And I teach interpreting and translation courses along with medical Spanish and cultural competence at the Catholic University of America. The other important part of this program is I lead an international clinical practicum, and this is in Nicaragua in the southeast corner near Costa Rica. And this is for healthcare professionals to volunteer their healthcare, their skills, and their language newly acquired or their medical Spanish skills at the Roberto Clemente Clinic, which is a private clinic in Tola, Nicaragua, which is a population of about 4,000 people. It's very rural, non-potable water, dirt roads. So you're working with some very marginalized individuals. And I'll talk about this program in a little bit. So about the program. So it's a 4-course certificate. You can take one class, you can take 2, you can take all 4. Once you complete all 4, you will receive a certificate. Each class does receive 3.5 continuing education units. You can take these in any order. There's 5-week per course. So you'll have a module that'll open up on a Monday morning and closes out on a Sunday. And if you take all of the 4 courses, it's 140 contact hours. The method of teaching is fully online. And this means it's asynchronous. And asynchronous is when you can access the material at any time from your computer, at any location, any time of the day, via the internet. And each week, each 5-week online module course, you will proceed through the material at your own pace, but there will be specific defined time limits. So usually it's a Wednesday and a Sunday, you'll have to finish up some work. Each week you will have to finish out on a Sunday. Most people dedicate between 8 to 10 hours per week for this through exercises, lectures, and assessments. So the program objective. So what we're trying to do is empower healthcare professionals, current and future, to better communicate in Spanish, to be able to expand their skill set, to serve traditional underserved Hispanic community, and also to identify and understand personal beliefs of their own beliefs and of their patient and family members, to provide culturally sensitive care. So some information about the courses and the continuing education unit credits. So this is geared toward anyone, current, future healthcare professionals, students, retired, working in the profession, or interested in maybe getting into healthcare. There's minimal or no Spanish language background, but if you do have Spanish language, it will help. This is pure medical Spanish, so you'll be learning how to address the patient, how to do intake, educate the patient on public health education, describe, symptoms, and explain treatments to individuals. So the outcome. So working professionals, we want you to be able to communicate at a professional manner. You will, through this, develop strong relationships with your patients and family members by reducing miscommunication. And that's the key, number one, is reducing miscommunication for better healthcare. We'd like for you to identify and understand personal beliefs of the patient and to provide the highest quality of care in a culturally competent manner. So the medical Spanish courses. So there are 3 medical Spanish courses: Medical Spanish Essential, Informative, and Communicative. These are all taught in Spanish with some English nuances to help you, but it's mainly in Spanish, so you acquire the language skills. So these are to develop conversational, and you'll be having written work, but it's mainly with your job. You'll be writing a lot, you'll be speaking to your patients, but you will acquire written skills with medical situations through, there's web-based lectures, you'll do role play exercises, dialogues, there are interactive audio and video assignments, there's voice recordings where I will grade your work and comment on your pronunciation. Focus is placed on understanding the various language barriers that may occur in Hispanic patients and their effect on healthcare. So it's really understanding these barriers. The course is set up through Blackboard platform. This is through Catholic University. So when you apply and you're enrolled in the class, you'll receive a Catholic University email. Through that email, you can access Blackboard. This platform is where you will go for lectures, where you'll go for information for the syllabus, for contact, how to communicate, all the materials you need. And then part of the course, you need to do assessments. So this is a Spanish for Healthcare e-text, and that's through Pearson's. Through that, there's a workbook that's connected to the Spanish for Healthcare text. So let's look at what the healthcare text looks like. So if you see here, Pearson is the publisher. It's called My Spanish Lab, and the textbook is called Spanish for Healthcare. So all 3 of the medical Spanish classes are designed for this book. So you only need to purchase 1 book, and it'll be online, and you'll have an access for all the classes. If you notice here, you can access the text through here. You just click on there, and the book will come up. Here's your assessments. So anytime there's a clock and a calendar, that is when it's due at 11:59, for example. There is work due on Sunday, Wednesday, and Friday. There'll be notes where you can read. You can also access the grade book and any information on your work and assessments. I can email you through here, and you can email me back. This is the Blackboard. This is where you'll get the Catholic University email. You'll sign on. It's through Catholic here. You will start with getting started, understanding how the course is run. The course modules. You will click on a course module title. I'll give you all the information, the videos. It's in sequence. So you just go from A, B, C to D. You can correspond with me and others. If there's any announcements, I will let you know and I'll notify you via email and through this platform. So like I said, there are 5 weeks, 5 modules, and this is where you'll acquire, be able to enter through and access your lectures. So the methods. So through this with Blackboard, you will have an oral lecture. You'll have a video lecture of me with the textbook going over the assessments and going over exercises. There'll be reading and listening, some translation, there's vocabulary exercises and dialogues. And that is through your My Lab Spanish for Healthcare e-text. Each week, there's a listening and oral and written assessment. So by the end of the week, we want to see how you're doing and how you progress and assess your improvement. The wonderful thing about this is you can study your own pace. With those weekly deadlines, 1 or 2 times a week, you'll get the work done and you can access this information 24/7. The grading is pass-fail, so that's a 70 or above. And at the end of each course, there's a proficiency assessment to see how you've progressed. And also at the end of the 4 courses, there is a certificate proficiency assessment. So for example, this is the cultural competence in healthcare course. So that's the fourth course in the group, which is in English with Spanish nuances. So this is taught in English and it's completely online. There is no textbook because the material you're able to download and read off the Blackboard platform. And this is to better understand and provide a framework for discussions and examples of practical approaches to cultural competence through readings, videos, audio lectures, group discussions. And this is the important thing, is this is a lot of interaction with your peers and your instructor on beliefs and closing the disparity in healthcare. Some of the outcomes of the course. So we're going to examine the relationship between culture, language, and health. So all these things are main factors. So if you acquire some medical Spanish skills, you understand the culture, and then the outcome is for improved health. We're going to analyze cultural sensitivity, so some attitudes that patients may have, and knowledge and awareness of healthcare. You're also going to develop culturally appropriate communication skills. So that's the key point in this, is to be able to communicate and understand in a sensitive manner. So the International Clinical Practicum in Nicaragua, these are two students that actually went to the undergraduate, through the undergraduate certificate, and then graduated, and as RNs traveled with me for a month, a couple summers ago, and we worked for this wonderful nurse and the doctors in the Roberto Clemente Clinic. We would do daily rounds, we would give public health education classes, and we'd also do rounds in the neighborhood from house to house for those that could not get to the clinic. So this is called MPD 125, International Clinical Practicum. This is an optional 8-day international trip. And this is where the group decides they'd like to go in the spring, fall, or winter. It'll be 35 contact hours working at a private, which is the Roberto Clemente Clinic, and a public clinic, which is Centro de Salud. And this is a clinic that has very little resources. So you'll be using a lot of assessment and a lot of working one-on-one with patients and the healthcare providers. It is a very marginalized area, and this is where you'll receive firsthand exposure to global health issues. You'll be mentored by certified medical preceptors. There are physicians, EMTs, pharmacists, nurses, PAs. And we also participate in a health fair. So every trip we'll do a health care. Recently, we just came back from the March 8th International Women's Day Healthcare. Over 355 wonderful, women, children, and fathers and dads were there. And we were able to educate, screen for healthcare prevention. There was 15 of us. We had 3 different tables set up. One group was working with the diabetes and the illnesses related to high blood pressure, obesity, and diet and exercise, and your heart. Another group was first aid. That's the most important thing. Is since the area, the local hospital is maybe an hour away, these clinics are just to get you to the hospital if it's a serious illness or accident. So they're really, really interested in the first aid and how you prevent some illnesses and injuries. Through this program, you receive 3.5 continuing education units for the 8-day trip. This was a trip we took 2 years ago, and we have Erin Rose Larson, who's an oncologist from Johns Hopkins, and she was able to lead a class on breast exam in women and in cancer, and help answer questions. If you notice, there's some flyers up in the background, some posters. This really helps when we leave and they return, they'll be able to see what we did and follow through with some of these exercises. We did a public outreach with dental. This is Carrie King, who worked at Sloan Memorial Kettering. And we were doing a wonderful trip from school to school, and it was a fluoride treatment program. We also do anti-parasite and personal hygiene. We go to classrooms and work with the students. There is no potable water, so a lot of the students do get ill and sick, and we need to help them with, the anti-parasites and personal hygiene. We'll do classes on washing hands, brushing teeth, and better understanding how to stay healthy. Public health education, I love these. We did a brigade where we walked around with the public health nurse with a vaccines in a cooler, went from house to house. Each member had their passport for their child or their themselves, and we were able to check off and do vaccinations. For adults, we gave tetanus shots, and this is a great way to really, be part of the community and see how these people live. There is a big problem since there's dirt roads and without potable water. There's a lot of respiratory infections, so we really worked on educating the families on keeping the ways of preventing and identifying respiratory infections. We also do lice prevention. We go into the schools and we educate them, and we do hair washing and work with the teachers, which is a wonderful opportunity. And then usually we'll do an international kids sports and health clinic. So this is Fun Limon, the Mark and Catherine Ford Family Foundation, and that's across the street from the Roberto Clemente Clinic. Here we will play sports with the students. We will do some public health education classes, diet, exercise, the importance of just staying healthy and really keeping positive and really embracing, what we have with what we can share with this community. These courses are offered fall, winter, spring, and summer. So, we have a running list of courses, and if you want to sign up for a course, you just go right to the web page, and there's a form, and I'll show you later. The program, we also do tailored programs. So if courses can be tailored to groups, organizations, hospitals, clinics, there's a group that just needs first responder or for oncology or for OB, we can work with you on what your needs are. We can do on-site workshops for continuing education credit. There's face-to-face classes we can set up with you, or hybrid classes. So really we can tailor these programs for you and what you need. The tuition is $1,500 per class. There is a 10% scholarship available to any Catholic affiliated university, organization, hospital, clinic, school, or any CUA alumni. And the most important part about this is the employer tuition reimbursement. Most of the participants will go through their HR or their continuing education coordinator and fill out forms to be reimbursed for the course, because it is a certified program, and you will receive that certificate as proof to show that you completed each course. So please check with your continuing education coordinator or your human resource department for the tuition reimbursement. And this is pretty much the reason why I do this program, is that I recently worked with a PA in Ohio, and she took this class, was very apprehensive at first, and through the class, her confidence slowly was improving, and she was able to work with a patient who came in from Puerto Rico. And so really, you make strides, and it's something that's important for your professional growth and development and for your patients and for your hospital or organization. So the next class is May 7th to June 10th, and that's Medical Spanish Essential. That's 121. And then after that, June 25 to July 28th is Medical Spanish Communicative. That's MPD 123. And in the fall, we'll be starting another round of Medical Spanish Informative, MPD 122, and then the Cultural Competence in Healthcare. That's the English, class of English with Spanish nuances. So admissions. Admissions is Tony Boehm, and he's the Associate Director. He can be reached at boehm@cua.edu. Also, you can type in metropolitan@cua.edu if you want to send an email, or call 202-319-5256. And so you can fill out the form on the web page, and it'll just say fill out form, and form will be hyperlinked, and just click on that. And this is rolling admissions. It's free to register. It's free to apply. Students, you can apply at any time for the next available class. And you can contact me, Jennifer Maxwell, at maxwellj@cua.edu. I look forward to hearing from you.